Okay. Hi, everyone.
Okay.
This is Sharina Ankhi-Krol. Today we have with us Dr. Christian España, and he is in Danbury Hospital in Connecticut. So he is taking his time out from his very busy schedule, I should say, to speak to us and give us a firsthand experience of what's going on with the coronavirus and how that's affecting everyone's lives at this point. So Dr. España, would you like to elaborate a little bit more on what you're seeing?
Oh, yeah, sure. Thank you, Sharina. Nice to see you. Okay, for your for the people that is using this. Yeah, we have basically a big surge of cases here in Fairfield County. We are one of the hotspots of the Northeast, basically.
Mhm.
Probably secondary that we are near New York. So from Connecticut, as far as I understand, we have the most cases, well, this is and it continues to increase every day. We have also many cases in our hospital, and we are part of a hospital network that is called Nuance Health.
Mhm.
And well, we have a lot of beds, thanks God, and a lot of hospitals in the county. So far everything is being managed, but it's quite a change in the lifestyle of everyone.
Right. So, I was seeing actually even on my Facebook feed, people in the middle of the country, they're actually asking on their status updates if this is really happening. They're just in disbelief because it hasn't really hit them as hard as it has hit
Oh.
us in the East Coast, if you can believe it. And in one particular status update I saw, does anyone in my friends list actually personally know someone that's gotten sick? Which was amazing to me because here I am in New York, New Jersey. My office is in New York City, as you know. That's how we met
Yes,
years
yes,
ago.
absolutely.
And I live in New Jersey. And my neighbor's mom actually passed away from the coronavirus a couple weeks ago.
Oh
And then
no, I'm so sorry to hear that.
yeah, it was really horrible. And what people are not understanding either is that the
Oh my.
funeral arrangements right now are very limited to who they're letting in at this point. But so I just
Correct.
wanted to ask you to say sort of how do you think this is going to change the future of small business owners? Because we are the
Oh,
ones that are out there, having to network and meet people in person. How do you think this is going to change more than it already has now?
so it's very interesting that what you are asking me now, because actually this has been uh, what I have been discussing also with some authorities in my country, in Guatemala, what was going to happen with the small business.
Mm,
So this is what I know from the medical perspective, right?
mhm,
Right now, we sadly need to continue have social distancing,
mhm,
and this and definitely this is just to slow the spread of this virus. We don't know how much we can slow the spread. We know this virus will affect, if we don't do any social distancing, each person will affect three other people, and these three other people other three, and then like that, and so suddenly we will have an exponential growth, which is what we call the curve. And we are trying to flatten that curve in order to keep our resources. Having said that, how long we need to continue this quarantine, or this self isolation?
mhm,
The truth is that America doesn't have the data. We are trying to ramp up all tests everywhere in America. I would say New York is doing a good job so far. A little bit late though.
mhm,
Um, um, Connecticut is doing a good job, also a little bit late, but other places like in the center of our country, they are kind of really taking too slow the measures to isolation and testing and preparing for this. The big problem I see for us, and I also have a small business, by the way. So the problem that I see for us is that we don't know. There is a lot of uncertainty because we don't really have a real projection. We don't know really how many people has it. We are just testing people who has symptoms. So this is just a part of the population, and we don't know the whole thing. We don't know the whole story. So until we are able to test more and more, we are going to be able to have an idea. Right now, it's impossible to have an idea. I'm sure you have here in CNN, Dr. Fauci, and other authorities. They really, it's very difficult right now to know when this is going to stop, and the social distancing is going to stop. For sure, we will need to change the way we do business for a while. Yeah.
Right. So do you think once everything is under control and everything is back to normal, as normal can be, in the future, do you think the way we used to greet people and all of that, do you think that's going to change as a result?
So this is going to depend a lot on two factors. First factor is we still need to learn a lot of the virus. But sadly, in America, we started a little bit late putting our scientists in figuring out about this virus.
Right.
We don't know if this virus will leave immunity. We don't have a vaccine, and we don't have treatments. Right. So everything is experimental right now. Let's say that we find a vaccine, right? And the vaccine is effective. Probably our life is going to go back to normal, but we expect that vaccine at least 10 months, possible. We don't know. The second thing is when we know more about the virus, who has the virus, maybe we can do what the Germans are trying to do right now. It's see who has been affected that they didn't knew that was affected. And these people, they are testing to see if they have immunity. It's kind of risky, but this is what they are doing. And they are sending these people to restart the economy. And we expect that the people who already have antibodies, which is the way that we fight viruses, is they can restart the economy. We know from prior endemics, like epidemics, like the SARS one that happened in Asia, in the MERS, that there is some immunity. So we hope, right? We hope, right. But we don't know. We cannot say for sure. So right now, the Germans, what they are doing is testing everyone for antibodies who is already immune. They are going to send them out to work and restart the economy. I really hope we start doing that like fast. I understand there is a few places like Mayo Clinic, some places in New York that are doing antibodies, but this is just for treatment. They are doing experimental treatments right now with that. So we are still like lagging in that. Yeah. Mm-hmm. So I don't know the truth. It's very difficult to make a prediction until we have a better picture of what is going on in America. Yeah.
Right. So one last question I do want to ask you is that some of my clients who are in rural America, not near any cities, they're saying that maybe it's not going to reach them because of the lack of people around them. And so they're just really going by, doing things that they normally would do because of their lack of interaction with other people. Do you think that's a naive sort of way of thinking about it if they never really come across many people?
So it will depend a lot on the place. I can tell you then that if I'm not wrong, it's Norway. Norway, they have, for the extent of their territory, 10 million people,
Mm-hmm.
and they are actually just quarantining the elderlies, and they are letting people with low risk go ahead and get the disease. I mean, it's a risky business. It had failed big time in Netherlands and Belgium, but Norway is still going through this. I mean, they are trying. I would say it's a little bit naive. It's very important to judge what you are going to do depending on the resources of your community. If you, let's say that you have a million, and let's put the very easy things. Let's say that there are 2,000 people in your community, right? And your hospital has 40 beds, and from these beds, it's going to be 4 or 5 beds for the intensive care unit, right? So you are 2,000 people. Let's say that just half of these people get infected, right? And just 1% of these people will need a ventilator, right? Which is going to be 10 people. Well, so maybe they can take care of that, but let's say that instead of 1% happens like it happened with the people in Italy, right?
Mm-hmm.
They have 10%, right? They are going to overflow the services, and at the end, there is going to be people that's going to die, not because of the disease, but because they overflow their services. So that's the real risk on what you are saying. I mean, if we had, or when we have more information about who has really the virus, who has already immunity, we can do that prediction. And that's why if you see Dr. Fauci is very, very cautious every time he's asked this question, because we don't have enough information. We don't know if we can open certain parts of the country. We don't know right now. We really don't know. It's the information is lacking, and I know there is a big improvement of our testing, but we are not there.
Right. Thank you so
We're
much
yet.
for that. Thank you.
Mm-hmm.
And just, I know you are on break and you're very busy. So one very last question for you is, I know you're treating some of the coronavirus patients in your hospital.
Yeah.
And we as outsiders who are not going out and being exposed to that, thank God, we just know some of the common symptoms that we should be looking out for, the fever, the dry cough being the main indicator. What are you seeing in the hospital, so people can just get an idea of how severe it gets when you are finally admitted?
So it's interesting. That's a very good question. I have had some. We don't see, of course, not everyone is seeing this viruses, right? We're trying to put them in special places, so not everyone gets infected. But just yesterday, for some reason, I had seven transfers from other hospitals because the other hospitals are full, and it's interesting that I didn't saw anyone above 55 years. So everyone that was being transferred on oxygen was not the typical patient, right? The second thing is that in some people we can find there is some people that come with just altered mental status, so they are not, their consciousness is not normal, and just to develop the respiratory symptoms later. The other way that this can happen is people start with diarrhea, and then they start with cough and shortness of breath. So there is a mix of ways that this disease can present right now. We're still working on that. I mean, papers we have are still from China. We have one paper from Seattle, and this is what we are learning on on our while we are dealing with this. Yes.
Well,
So there
thank you
are
so.
different ways. Yeah.
Yeah, I had no idea about the diarrhea because that's not something
It
that
seems to
is
be a
being
very
said.
important thing. I heard. I just heard not even 24 hours ago. People in New Jersey are having a lot of these type of presentations. Why New Jersey? I have no idea. We have some, but definitely New Jersey has more. Yeah,
That's
I don't know. I don't know. So until we have published data and we have more data, this is what I know right now for what is
Mhm.
published and my communications from other people, infectologists and internal medicine. The last thing is that if any one of your clients still think this is not real, it is real. I already have friends in New York, fun friends, physicians that have been infected,
Mhm.
and they have had some of them have had a rough time, and they are young. I mean, they're not nothing like the high risk patients. So they had a rough time.
Yeah. Well, thank you so much. I really appreciate your time and all the things you're doing to help everybody. It's
Absolutely.
and it's so great to see you again after so many
Uh,
years.
yes, yeah, Sharina, absolutely.
Thank you.
Yeah.
And I
Tell your
hope you
clients
stay
to follow
safe.
the government and to continue their social distancing, and hopefully we'll have more data. Yeah.
Absolutely. Yes. Let's hope for the best. Thank you so much.
Okay. Bye bye, Sharina.
Bye.